Hi everyone, this is Dr. Shelly and today we'll talk about ammonium group. So before we start about ammonium group, I would like to just give a small brief up which are the different ways how you can understand a remedy and which are the different ways how you can enter into a case and reach a minimum. So there are different ways like you can have physical entries to understand, mental entries to understand, emotional entries to understand, and pathological entries to understand. So whenever you study a remedy from all the point of view, the physical, emotional, pathological, and mental, you will see that you can cover a broad picture of a remedy, and when you prescribe it can become much easier to understand. So today our group ammonium will understand from all the four aspects. So let us start with the understanding of ammonium. So just imagine that you're sitting in your cabin and there is this patient entering. He is fat, he is very ugly, unclean, lot of bad odor coming out of his body, specifically sour odor. He is very slow in his walk. He is very lethargic. He is walking a few steps and he's feeling breathless. Again, he is walking, he is feeling breathless. He's trying to talk, he's feeling breathless. He's fainting, he's getting into the cabin. And he has this very serious look in his face as if he hates the world. So even when you give a good smile, hello, come, welcome, he will never smile back to you, right? So this can be one of the important indications for ammonium personality. So what we understand is they are very tired, they are very lethargic, they are very weak, they are fatigued, they are exhausting themselves with the disease and their body is not reacting or responding to any kind of treatment. They may be having a cardiac pathology or a circulation pathology or any pathology, but they will always present themselves in this particular way. They will mostly present themselves in this particular way. So when they sit in front of you and you start communicating with him, and when you start communicating, you ask him, since how long you have this disease? So he may explain, I am suffering from this since maybe 5 years or 8 years or 10 years or 2 months. So you go back to him. So how did it start? That's a very important question. Ki how did the pathology start or how did the man fall sick? So he will reply, I do not know. Then you have to probe to his emotions and ask him, what have you been through before you start this disease or before you started falling sick? So he may say, yes, I had a partner in my business or a friend or anyone with whom I had a very big fight and then we separated. He spoke something bad for me, I spoke something bad to him. So since then I'm not well, and he starts abusing that person, right? So this personality is a personality who doesn't forgive people easily. They carry all the hatred, they carry all the anger and indignation with them all the life, right? So they are just thinking about that incidents, thinking about that personality, and they are creating a lot of hatred for them. And in that process, they do not realize that they have become themselves very difficult. They have become a kind of personality who is very ill humored, who do not like to meet with people, who do not like to mix up with them, who doesn't enjoy life. They have become listless. Day by day, they are as their pathology develops, their hatred increases, and they have become listless personality. They do not like people. They start forgetting things. They start making mistakes in writing, and they become very vindictive. There's a very special symptom of ammonium कि whenever there is a bad weather, the whole day they are mentally very unstable. They can become very angry, they can become very angry, or all the bad memories come back to them. So we cannot forget ammonium in these entries. Hmm? So looking at the personality also, they do not like washing. So you can see them very ugly. They are not neat. Their nails are not properly trimmed. They do not have a properly combed hair. And you have this rubric in your repertory, elegance want of, which again points out to us towards ammonium. We may think he's a sulfur, but he can be ammonium. Going into the pathology, ammonium personality broadly or ammonium group broadly acts at three levels. One is at the mucous membrane of the body, second is circulation, and third is the blood. So working on the mucous membrane, they have tendency to increase the discharges of mucous membrane. So wherever you have mucous membrane, the function increases. For example, the lungs, they have lot of mucus, rattling cough, audible rattling cough, right, which they are very difficult to expectorate. You can think of remedies which are near to him at this point is carboveg, antimtab, arsenic album, but it can be ammonium also. Rattling cough, chest full of mucus, not able to remove the cough. Every time he starts coughing, he becomes blue. His lips turns blue, or the child, when he's coughing, the child's lips or fingers turn blue because of the mucus, and the child is not getting enough of oxygen. Now, first thing was mucous membrane. Second, going to circulation. This remedy acts strongly on the heart. It causes cardiomegaly or it decreases the function of cardiac muscles. It can cause atherosclerotic changes in the blood vessels. Okay, so we have a very strong symptom of ammonium is the heartbeat is audible. So when you sit or auscultate a patient or he is a cardiac patient and you can hear his heartbeat just standing near him, we can think one of the remedy is ammonium. Okay, so we have spoken about two spheres of action main, that is one is the mucous membrane, second is circulation. Now coming to blood, ammonium is a remedy which do not allow the coagulation of blood. So in ammonium personalities you will see is the blood do not coagulate easily. So they are bleeders. Okay, they are bleeders, and the blood which comes out is mostly blackish in color. And most important thing is this ammonium, how does it cause it doesn't allow the coagulation. It is beautifully said by one of our stalwart that the ammonium uh, the ammonium, when it enters the circulation, it increases the alkalinity of the blood. So as the blood's alkalinity increases, this increased alkalinity suppresses the coagulation of blood, and the suppressed coagulation of blood along with decreased carrying capacity of oxygen causes breathlessness in this personality. So these are the main three sphere of action of ammonium. Okay, so today we have understood ammonium. In short, there's lots and lots and more about ammonium, but in short, we can understand his physical aspect, his emotional aspect, his intellectual aspect, and his pathological aspect. So there is more about ammonium carb, mure, and sulf. We'll talk some other day. Hope you all like my lecture. Be in touch. Take care. Have a nice day.